and all of the other people that we have here tonight to greet you and to be a part of this special event. So thank you for coming, and now it's our job to try to make this interesting enough to you that you're at least willing to consider a next step. What I put it, and I'm not going to look at that because I'll be falling off this stool, but I've got one slide. That's what they limited me to. So how I'm going to talk for 45 minutes by one slide, I don't know. But SelectWell, I wanted to talk about the innovation of what we do. When we formed a company that became LabCorp, it was built on innovation. And I'll introduce our Vice President of Innovation and Laboratories, Senior Vice President, that's Billy Fox. He's the other guy with the gray face and gray hair. And we've been working together more time than I'd like to think about. But we've been very fortunate that our ranks are filled with people that, those of us that go back in time, we learn to work with each other and develop. And we're continuing to do that with all of the members of the team who are excellent in every way and joined us, and I'd like to just thank them and compliment them on the job that allowed tonight to happen. SelectWell is not a run-of-the-mill lab. SelectWell is something innovative, and it's creative, and it's unique. And I want to just get a message across to you, and that is that, you know, when we started our little lab with $60,000 and a total of 3, within a couple weeks, 4 employees, we were a whole lot less than what we have here. And we successfully built the largest lab in the world, and it's spread from coast to coast, and I could go on for hours, as the team knows, but I've been told not to let that happen, Tori. Over 4 years ago, we started developing a line of special tests which would set us apart and make us different than the monster labs, LabCorp and Quest and the other labs that you've heard about. Better than what, you know, Cone Hospital has. And we quickly learned that we wanted to be in a space where we served the customer directly. We didn't want an insurance company between us and the customer. The insurance companies today are making an unbelievable amount of money. I'm not saying they don't earn it, because it's the only choice today. We made a decision to become self-insured, and we are self-insured as of January 1st this year. And we're relatively small. All of the people that we cover in the self-insurance pool, somewhere around 150. And we don't have the results to show for it yet, but we will this time next year. And what we've done to set ourselves apart is we develop tests that are not the tests that Medicare third-party payers ration, because healthcare at a lab level is rationed. They pay, third-party payers pay 25% on average of what Medicare pays. Medicare is the biggest user of lab services in the country, and they're paying $1, and everybody else is paying 25 cents. You don't get great quality when you're being paid 25 cents on the dollar. Criteria that is brought to the forefront, except for what the physician themselves evaluate and find during the initial evaluation of you as a patient or your employees. So we want to stick with that value. Our tests predict not just disease and the direction of your health today, it projects what's going to be happening in all likelihood 5 years out or even longer. And for the major diseases, which I won't name, that we're all concerned about. So improved tests, appropriately assessed, and including a coaching or teaching module, which we are going to include in every component, and then guiding the patient as to the best choices and what should they do based on their true health from our assessment. And then we want to motivate that patient with coaching, especially our integrated health coaching, which will help guide them as to the best choices they can make to extend the quality of their life for as long as possible. As far as our other goals, we're utilizing these advanced clinical markers that are not covered by current insurance. If we counted on Blue Cross and United Healthcare, Cigna, et cetera, to pay for the tests we have, we'd be waiting so damn long, we'd go out of business in the process.
Believe are issues. How many people really know their health? How many people really understand their health? And does the traditional healthcare plan make that happen, or the traditional healthcare system, does that help support that people know their health? And the other thing is maybe the biggest issue is are people really engaging in their health? And we're going to make it easy, because what we're going to do is we're going to bring healthcare to you. Okay? So I'm going to move forward and just kind of put this up here. I don't know if anybody's seen this data before, but it's interesting enough to look at this and think about this. We know the cardiovascular disease is the biggest issue in health for the U.S. market. Look at that number. Employers, it's $363 billion annually that companies are having to deal with because of cardiovascular disease. But the gold standard as you go into traditional health care system and you have your blood work done is they're going to come back and tell you, where's your cholesterol level? And more importantly, where's the LDL level? And if your LDL level is high, they want to put you on a statin. Anybody in here want to admit that they had these questions of where's your cholesterol level? Your LDL level is moved into a level where they want to put you on a statin. I don't know if anybody wants to agree or put their hand up. I'm one of them. My doctor just tried to put me on LDL, on a statin, because my LDL level went up into a number. But here's the data, guys. This is what's incredible. They actually did a research study. They followed individuals that were going into the hospital that were having some type of cardiac event and were eventually admitted into the hospital. And what they did with this study, which was almost 140,000 patients, they went back and looked at their LDL levels as they entered the hospital and what it was prior. And this is the crazy thing. 75% of those individuals had what was considered a normal LDL level. So if LDL is the gold standard for following cardiovascular disease, then why are 75% of patients that are showing up and presenting in some type of cardiovascular duress and a heart attack, they have normal LDL levels? You have to ask yourself, okay, are we looking at the right thing?
This is actually part of and a primer and a catalyst for one of our medical advisors. We've got a gentleman that we work with. He's an incredible preventive cardiologist. His name is Dr. Robert Saperko. And he's looking at information like this because one of the things that he realized, and he's been asked to look at, and he actually ran a FEMA study. The FEMA paid for about a $3 million study, because think of some of the people that are more, some of the most healthy people you would think in your local communities. Firefighters are pretty healthy guys. Look at what they have to do physically to go in and save others. More firefighters die of heart attacks than are killed by the fire itself. How could that be? Sudden cardiac events kill more firefighters than actually the fire itself. And why is that? And the crazy thing is by law, every firefighter has to go through an exam, an annual exam every year as part of what's called NFPA 1582. And that exam includes blood work.
Right? Ernie talked about we're lab experts first. We didn't know this. We weren't aware of this information about the LDL or the firefighters. They're getting routine, lipids run annually. If they have high LDL, they probably get put on a statin or whatever. The point is that when we started talking to Dr. Saperko, who is one of the top preventive cardiologists in the world, he started, educating us on this, which is really where I remember Billy was a big part of this too. We started thinking, okay, what do we need to test for? And we were asking, one of the world's top cardiologists, well, what is it that you need to be testing for to prevent this and bring it to light? And that's sort of where the program started evolving from. So just a little bit of a perspective on how what this
Yeah.
data means in terms of where we're at with Select.
Yeah, but typically when somebody has a true heart attack and has to deal with a heart attack, they tend to, the average is they're out of work for 13 days. That's 13 work days. That's not over the weekend. But that's almost 3 weeks of work that they miss if they're trying to manage coming back from a heart attack, if they do come back, obviously. And as I said, 37 million Americans are dealing with diabetes. A little over 20% are undiagnosed. Well, look at the numbers that translates to companies that are dealing with it. You know, and again, 90 billion is actually in lost productivity. This is when these individuals are off work trying to figure out how to manage the disease. So, why are people just not managing their health any better than they are? I mean, you guys are spending the money to give them health care, to give them a plan to actually help them deal with their health and see a doctor. But the data now shows that 60% of US adults don't use primary care to manage their health. Now, there is some generational data to that, but the data is that 60% of American adults either don't have or don't use a primary care physician. So what does that mean? They're managing their health from one acute event to the next. And they show up at the urgent care to try to get help. And if they present themselves in any way that the urgent care feels like there's a liability that they don't want to take on, guess where they send them? Directly to the ER. And if you've been in an ER over the last couple of years, these places are madhouses. They're just full of people that are trying to manage their care. And the data would suggest, as we have here, 60% of ER visits are actually defined as avoidable. These are the people that are coming in there, everything from sinus infections, abdominal issues, respiratory issues. They just choose to use ER as the way that they manage their health. And again, there are people that are in chronic conditions, they have chronic illness. More than 30% of those ER visits are not necessary. That's another 8.2 billion that's going straight to companies paying for this when it's not really necessary to do it in the ER. The system is actually set up to manage people who are sick. It's not health care, it's sick care. And that's a big issue. And the total cost of this is falling to businesses that it's considered to be, it's going to run to 2 trillion by 2030. But look at the number, almost 800 billion of that is just lost productivity that companies are experiencing. We believe that and we've got data to show this, 75% of what healthcare plans are covering are about 1/3 of the employees that are dealing with chronic illness. So that's the thing that we're trying to address. So what are we going to do? Poor health behavior is the whole reason why it's escalating. And we said people are not going to see a primary care physician. Why aren't they? Well, we all know this. I mean, I don't know about families here, but I've got a 26-year-old about to turn 27, one that's 23. My kids won't go see a doctor. They're not going to. They say that it takes them 3 hours of their life to go in, sit in a waiting room, then to sit in a examination room, to have a nurse come in and go through a checklist of questions, and the doctor walks in and spends 5 minutes with them. And they walk out and they're like, what did I get out of this? So they're the ones that are going to the ERs. Perco was part of it, Patrick was part of it. We're gonna do that blood work, but if you can't get them to come to the doctor, how's it gonna get done? We're gonna come to you. We're actually gonna come on site and do that blood work, so it's easy to participate. Then what we do is we actually take that advanced testing, and these are some of the areas, and if anybody's got any questions about this, we've got an actual booklet here that talks about these areas of inflammation. Why do you test inflammation? Why do you test antioxidant defense?
metabolic risk, cardiovascular risk in a way that you don't normally. These are different tests that we're running. We've got all that information. We'll show you what that is. But we want to raise awareness, not when you're, as Ernie said, it's not about confirming you're sick. It's understanding where are you with your health and making sure that we can help these people understand their health before they move into. They're going to walk through these panels of tests and explain it to them, and explain what does this mean, what are the risks, what are the considerations, how do you look at this in a different way about your health. I can tell you, when I did this was the secret sauce. I had a 30-minute conversation with a clinical educator that told me about test results. I got test results from my doctor every year. I had no idea what it said, other than the fact that if he didn't tell me there was anything wrong, I must be healthy. If you look at it, the way that blood work is done now, you're either sick or you must be healthy.
It's either red or not.
It's either red or it's not. And so when you say something to somebody and you say, hey, what did your blood work show when you came back with your doctor? Well, he didn't tell me there was anything wrong. Well, how healthy are you? I don't know, I'm just not sick. When these guys go through, they actually tell everybody where they fit across the spectrum of optimal health to moving into a chronic risk disease, chronic risk issue. And then the last one is, and Amy's here, she heads up our integrative health coaching. This is critical. And we were actually talking about this. Tim and Daryl's still here. Marty, who's with their company, he had to leave. And you know why I had to leave? Because he has a committed meeting with a coach that he works with every Wednesday at 5:15. And I said, I told him, I said, Marty, I'd be so mad at you, but when everybody finds out why I told you you had to say, that goes completely against this, because Marty's committed to go deal with somebody to help him with his health. But that's what Amy helps people understand. How do you put together a game plan individually that will work for you to help you get all of that information about the testing, your understanding of what that testing means for your health? What do you go do about it? Because I will tell you this, we do have a couple doctors in the room. We're not doctors. We're not doctors. But what we do is we do provide access to physicians. So we said 60% of people do not go see a primary care physician on a regular basis because they just won't take the time to do that. If nothing else, COVID proved that telemedicine works. So we partnered with a company, it's called First Stop Health. They've been in business for 10 years. They offer everything from primary care, which means you're gonna have one doctor talking to you on a regular basis about your health and you set up appointments with them, to on the weekend, your kid has an earache at 8 o'clock on a Saturday. You can call them and they'll work with you on getting you a prescription for that child. Have done the research. We can show, and we want to work with every one of these companies, we can show that this program's ROI is 1. If you put $1 in, it's going to pay back. That's conservative. We think that this program could actually deliver an ROI well above 3. It just depends on how engaged we can get your employees, how many people we can get them to understand that their health risks are high enough to take action on it before they head into a full chronic disease state, and we move them into the right direction and we give them access so they don't end up going to the ER for something they don't need to be in the ER for. So,
But again, we would love to continue this conversation based on the specifics of your company and how we can deploy this. This is not one size fits all. We want it to work for your company. But I think it does come back to what John says, is that the cost of the program, we truly believe, is going to pay for itself literally in productivity, let alone cutting off unnecessary emergency room activity and keeping your people healthy and keeping them on the job. So we think this program is going to do a lot of things that are going to be we think it's going to be transformative.